So, good morning, good afternoon, good evening to whoever is listening or watching this podcast on a fine, lovely day. With me, I have Dr. Anthea, and she is someone who is a specialist in women's health. Not only is she an author, she's also a great speaker, and she specializes in many different aspects in getting women healthier naturally. She's someone who has looked into the current way women's health is approached towards and has noticed gaps. And those gaps have started to influence how healthy women can be. And who better to explain it better than myself here? Dr. Anthea, you have the stage.
Thank you, Dr. Oz. Yes, for those of you who don't know me, I'm Dr. Anthea Todd, and originally I trained as a chiropractor. Both my parents are chiropractors. I grew up around it all my life. I wanted to be a chiropractor since the age of 4, and after 5 years of study, I was out in the real world working with women and men. But a common trend that I noticed was that a lot of my female patients would be experiencing things like hair loss or difficulty losing weight, PMS, heavy flooding periods, menopausal symptoms, difficulty losing weight, all of those things. And as a chiropractor, we're trained, that's not something that you look after, so refer out. So I would be referring them out to their GP, and they'd do a whole host of tests, and most of the time, thankfully, they'd be told there's nothing wrong with them, which they would come back to me and say, oh, the GP said that there was nothing wrong. And I just noticed the look of defeat on their face, thinking, well, if they say there's nothing wrong, then this just must be my normal. I just have to feel like this. It's normal for women to feel like this. And knowing what I knew, I know that that is not normal. It is not normal to feel like that. And so what I did was I decided to go on and study a master's in women's health medicine and another master's in reproductive medicine, because I thought, well, maybe the GPs in my town just don't know what they're talking about, which was very ignorant of me to think, because they do, and they're very, very smart people. It's just that what I realized when I studied the medical side was that medicine, the medical lens is only looking for, do you need medication or surgery for us to help you and keep you alive? And if you don't, then it means there's nothing wrong with you. So whenever you're told
So true.
by a doctor, a medical doctor, someone that's using a medical lens, if someone tells you that there's nothing wrong with you, but you still feel like there is, you still feel like your body is giving you signals of like, hey, I need some help, just know that what they're saying is you don't need medication or surgery. They're not saying that there's nothing quote unquote wrong. So that's what I discovered was this sort of, I call it lost in the space between. You're not feeling amazing, but you're also not sick enough to need medication or surgery. So when we're in that space, it's sort of like, well, what do? I just have to wait until I get bad enough to need medication or surgery? Like, that just seems silly. I don't know about you, Dr. Oz, whether you see people like this, but it's like, I really want to help you, but what do I do? So as chiropractors as well, or people that are trained in allied health, we're not necessarily trained in how to care for these people either. It's sort of like, okay, let me see, what are we doing about the gut? Or is it your stress response? Or what's happening with your thyroid or your diet? Or should you be doing cold plunges or breath work or all of these things? It's sort of like this functional space, I call it, the
Yeah.
functional lens is a bit confusing. But so what I did then was I studied functional medicine. And what I discovered from that is that basically I call it the 4 female fundamentals. If you're lost in the space between, it means you need a functional lens. And the functional lens can be overwhelming to know where do you start. But functional lens is literally, what does your body need to function? That's it. So if we think about it coming from your body as opposed to the next magical fix being outside of you, it's the ice baths, it's the fasting, it's the next supplement. Those things can help, but what they're doing is they're helping one of your fundamentals or multiple of your fundamentals. So the 4 female fundamentals are your nervous system, your metabolism, your nutrients, and your blood sugars. If you can help to balance them, your body has what it needs to function, so your symptoms fall away, which is great. So that's where I sort of progressed into. And then, oh, yes. Sorry, I'm
Could you
going on a
repeat
roll.
those
Go,
4
Dr. Oz.
again? Could you
Yes, I
repeat those
can.
4 fundamentals?
I can. So the first one, in no particular order, there's no one that's more important than the other. but they all impact each other. So there's the nervous system,
Yep.
metabolism, nutrients, and blood sugars.
Love
So
it.
say, for instance, someone's like, fasting, that's the best thing you can do. That's what you're meant to do. Fasting is really looking at it's trying to help your blood sugars and your metabolism. It's sort of focusing on those two.
Yep.
But sometimes if your nervous system is so wired, fasting can actually be perceived as a threat, and it causes a negative impact on your nervous system, one of the other fundamentals. So that's why it's important to not necessarily make decisions based on your Instagram algorithm. It's based on what's happening with your body. What is your body telling you it needs? Instead of going, oh my gosh, okay, well, they told me I needed to fast, so I'm going to fast today, and I'm feeling absolutely miserable, and this is making me more stressed. It's like, no, don't fast. It's not giving your body what it needs. So really being able to pay attention to the little signs of your body. And that's where I then progress into the energetic lens. So the three lenses that I use when I'm thinking about anyone, or when any woman comes to me with any symptom. It could be difficulty losing weight, hair falling out, dry skin, issues with their period. They could have been diagnosed with something like PCOS or endometriosis or hypothyroidism. I'm always thinking, what's happening? Do we need medication or surgery now? Okay, great, we don't. Let's balance the four female fundamentals with the functional lens. And then what's underneath all of that? That's the energetic. So I
Yeah.
think of energetics as, it can seem a bit confusing and woo-woo, and everyone's like, what is energetics? It's a bit ethereal. But what I think about it is, it's the things you can't see create what you can see. So
Beautiful
it's
way
the
of putting it.
really, really subtle messages from your body. If you get really quiet and you ask yourself, what is it that you're trying to tell me with this symptom? Like your hair might be falling out, and you might ask your body, what is it that you're trying to let me know with this? And you're asking in a curious way, because I know, me personally, I've struggled with adult acne, and I hated it, absolutely hated it. So if I ask myself, what is it that you're trying to tell me in that tone, my body's probably not going to want to tell me what is actually going on underneath the surface, right? So when we actually know and believe that our body is always looking out for us, our body is on our side, and you might not be thinking that, but let me tell you, it is the truth, because you're alive. If you're listening to this or watching this, I know that your body is on your side because you're alive. So when we go, okay, if I believe that my body is always on my side, and I can ask myself, what is it that you're trying to let me know? And then just sit and wait. So sometimes it can be things that is like, oh, my hair's falling out because what is the thing that makes you want to pull your hair out? I know you, Dr. Oz, you've got a little bit less hair than I do.
Yeah. I got the beard, the legalistic
Yeah,
beard.
you've got the beard, you've got the beard. But that's what I often ask my patients, for instance, with hair loss. I'm like, okay, is there something in your life that makes you want to pull your hair out? What is that? That is probably contributing to what's happening there. And also, I don't know about you, whether you've seen patients, I know it's a well-known thing amongst practitioners, is that if someone comes in with dizziness, and obviously we're making sure that they don't have anything serious going on, like a stroke or a VBI, with a medical lens, we're going, okay, well, is there, are you feeling in your life like you don't know which direction to take? You're faced with a couple of different options, and you're feeling a bit confused about what's going on. That can often induce dizziness in patients. So there's this undertone of subtlety, but your body is always telling you the answer. All of your symptoms, even though you might not like them, are literally telling you the solution. They're not the problem. So when we can come at it from that way, it's like, oh my gosh, you can develop this whole different relationship with your body and go, yeah, I don't like these things, but oh my gosh, my body's actually really looking out for me with this. Amazing. What can I do? I can look after my four female fundamentals and pay attention to those energetic things. Like, what really, if I sat with myself and asked myself, your body is actually going to tell you what you need to do. Yeah.
Okay. So first of all, that is deep, and I love to talk deep. So thank you for going into that much detail. And I'm gonna go even deeper with you. Is that cool?
Yeah, I love it.
All right. So basically, we talked about you talked about those four fundamentals, right?
Mm-hmm.
Give us a bit more of a detail on how you would actually do a breakdown. So let's say that I refer to you, or any female came to you for a problem. Like for example, sometimes I get females that come in and I'm not an expert. I know my medical side. I know what
Mm-hmm.
to screen for. I know if it's something within our scope, outside of our scope, but there's some things that we just can't help, right?
Mm-hmm.
If it's not the nervous system, then I'm just like, I know there's nutrients, I know there's vitamins, but I don't really know all the specific details, right?
Yeah.
So what would be your screening approach? Like, what would be your hello, lovely to meet you, Anthea. So I've got these irregular periods that they just can't classify. It comes sometimes earlier, sometimes it comes later. I just can't predict it.
Yeah. So first of all, that is a very, very common thing for a lot of practitioners to feel, because that's what I also realize is that there's no real practitioners that are trained to be able to help women that are lost in the space between. So that's why
Yeah.
I've actually created a practitioner course, which is besides the point, for helping practitioners understand how to care for these women. But what I think about, particularly when it's thinking about it, is a really helpful analogy, is that with women across their lifespan, physiologically we change. We know we're very different when we're in puberty than we are in perimenopause, for instance. So I want you to imagine that your hormones are like a lake. When you, like a lake before you hit puberty. So there's no ups and downs, they're nice and flat. And then when you hit puberty, it's like, all right, now we're going to throw you in the ocean. There's ups and downs in your hormones. The waves come and then there's a bit of a lull between the sets. So
Yeah.
when you first trying to start to swim in the ocean, you can feel like you're drowning because you're like, oh my gosh, I'm not used to these waves. And then you get used to the waves. You're like, oh, okay, there's an up and a down, and then there's a lull, and you can time it. Like, okay, great. So that's what happens in puberty. And then there's things called the great magnifiers. So puberty, pregnancy, postpartum, and perimenopause. So when you move into those different phases, it's like you change beaches. You could be in Wollongong, and then all of a sudden they throw you into Hawaii pipeline, and you're like, whoa, I'm not used to these waves, right?
Mhm.
So it changes again. But you will learn to adapt with those environments. It's a natural, healthy, physiological change that happens with everyone. But we know that some people struggle in puberty, they struggle in pregnancy, postpartum, perimenopause. Some people breeze through them. The difference is, what is the common denominator of every beach? There is a seabed floor. What happens when the seabed floor shakes in an earthquake? We get a tsunami. So that's
Correct.
why sometimes we might be getting, for instance, irregular periods. It's like, hang on, these waves, these sets are irregular. This isn't normal. Okay. So when we're thinking about like, okay, well, irregular periods, we can know your hormones are off in some way, right? So that's what our body is telling us when our periods are irregular.
Mhm.
But we go, okay, well, why are they irregular? What is underneath that? So our body is literally just telling us that there's something off. It doesn't have what it needs. So then we go, okay, I'll be screening what is going on with this patient's fundamentals. So say, for instance, with metabolism, you can either have a slow or a fast. Now, I want to preface that a lot of people think they have a slow type if they look at a cupcake and they gain 50 kilos. And a lot of people think they have a fast type if they're really lucky and they can eat whatever they want and not gain weight.
Sure.
So, weight and metabolism are correlated, but they are not hand in hand, because we all know that some people don't eat, like they can eat whatever they want and not gain weight, right? So
Yep.
we know that eating the amount of food and calories doesn't necessarily impact that. Okay. So when you have a slow metabolic rate, the most easiest way to know is that you will often feel cold. You'll have poor circulation. Things will be slow. So you'll often feel more depressed
Yeah.
mentally, but also fatigued in general, and feel quite cold, have slow hair growth. Your skin will be dry. Those things are very common signs of a slow metabolism. A fast metabolism is the opposite. It's like you feel really hot all the time. You sweat a lot. Those are signs of a fast metabolism. You can think of a metabolism like the engine of a car. If you rev your car really fast, the engine gets hot. Yeah. So
Yeah.
metabolism is just literally how fast your cells are converting energy. That's what metabolism means. Then, if we think about nutrients, I go, okay, what is going on with this patient's nutrients? So, nutrients to me is the fuel of a car. So, are they putting in the correct fuel? Can that fuel be absorbed? Can it actually get to the engine? can it be utilized by the engine? Like, do they have the other things? Do they have the oil and the radiator fluid and all of those other things to help it work? And then can they excrete it through the exhaust? So if someone has constipation, they're not using their bowels, I'm like, okay, their exhaust of the nutrients isn't working very well. That's
Yeah.
also linked to the metabolism as well. All of these things are linked, by the way. Then if someone is like, I get bloating all the time, I'm like, okay, you're probably not absorbing very well. Or for instance, they're like, I have to get iron infusions all the time. Like they just don't seem to stick. I'm like, okay, there's something going on with your nutrients. Either you don't have the other things to help you use it, or you're not absorbing it. And then also looking at diets, like, okay, what are you actually putting into your body? Do you have a good mix of protein, fats, and carbs? You shouldn't be avoiding any whole food groups because all of them are important for different mechanisms in the body. Some of them make neurotransmitters, which help us think and create nerve impulses. Some of them help make hormones that help our hormones that make our sex hormones or our stress hormones or our stomach enzymes. They're all really important. So obviously cutting out processed foods and crappy foods that we know aren't good for us is a really good thing, but also looking at what's in your environment. Are you getting absorption of other toxic chemicals and things as well that are coming in? And then in terms of blood sugars, there's common things like, do you get hangry or do you feel tired after you eat? Do you get skin tags or skin discoloration in the creases of your armpits or behind your knees? They're all signs that you could be experiencing blood sugar issues. And then the last one is nervous system. So your nervous system, you can think about it like a traffic light. So you have a green light, an orange light, and a red light. Most of the time, we want our nervous system to be in a green light. It's like if you go for a 2-hour drive and every single light that you hit is green and you find a car park exactly where you want it, you're like, oh my gosh, that was the best trip ever, right? So good. That's what we want our nervous system to be in most of the time.
Yeah, I can relate
But
to that.
yeah, exactly right. But if everyone had that, if everyone on the road had green lights, absolute carnage. It wouldn't work. Okay. So that's the same with our survival. So if we're always in green lights, humans would not be alive. We just wouldn't be. Yeah. So
Yep.
when we're in a green light, it's when you feel calm, curious, playful, a sense of pleasure. So if you don't feel those sensations on a daily basis most of the time, we know you're not in a green light. The next is an orange light. An orange light is like that fight flight nervous system. So if you go on that same 2-hour drive and every single light you hit is orange and it's bumper to bumper traffic and you struggle to find a park, how do you feel? Irritated, angry, frustrated, anxious. All of those emotions can come in. And what I often find with patients is you wake up and you already feel like you're behind. Like, oh my gosh, I've got a to-do list a mile long and I'm going to do this meditation for 20 minutes, but my mind is racing about all the things that I need to do. It's like,
Yep.
yep. Even though you might be doing quote unquote all the right things for your nervous system, you're doing the ice baths, the breath works, the meditation, your body can still be geared and wanting to stay in that orange light. Yeah.
Yep.
So it's about going, okay, what can I do that is a green light? Because when your body is in a green light, it cannot be in an orange or a red light. It can't. So seek out things that are playful. Playful is literally just doing things for fun, for the sake of fun. That's it. Pleasurable things, curiosity, creativity, all of those amazing things. And then the last one is a red light. And a red light, we all know that we all have to stop sometimes. A red light is a freeze fawn response. So I don't know about you, Dr. Oz, but I love to blast my music when I'm driving the car. And when I pull up to a traffic light, I'm guessing by that laugh you also do too.
Oh yeah.
Um,
Oh yeah.
when I pull up to a traffic light, I'm like, oh, I'll turn it down just a little bit so I'm not like blasting it with the cars beside me. And what that is, that's an example of a fawn response. So a fawn response is adapting your behavior to make sure everyone around you isn't irritated or they're calm. So that means you're safe. So a classic, that's like a sort of people pleaser. A lot of mums can fall into that because the trope of mums is make sure everyone else is okay and then everything will
Oh
be
yeah.
fine. Yeah. So
Can I
that's
add to that?
yeah.
Yeah. So in practice, I see so many mums that they always, I would say 99% of mums, they always forget about themselves. They always put themselves last. It's husband, wife, kids, family, everyone else. I got things to do, clean, cook, go to work, pick up the kids, look after the kids. if they've got new bubs, to look after, do all
Yeah.
the breastfeeding, the changing nappies, all of that. And then I go, okay, so when's the last time you took some time to yourself? And they just stare at me like saying, what are you talking about? You're crazy.
Yeah. Yeah. Yeah, exactly. And like, look, I'm not a mum, but I know a lot of mums, and I know that there are certain things that you need to do. And there's a lot of mental load that comes in on it. It's like, well, if no one else is thinking about, I've thought about those 500 things in my mind, even though they might not be getting done or whatever. I'm thinking, okay, that needs to be done. The kids' lunches, do we have enough bread? What's happening with their reader, or like, do they have music? Do they have the stuff? Like, all of those things are happening every single day in their mind. So I completely get that, but it's like looking back and going, okay, can I outsource a lot of those things? I don't have to be the person that does those things. So how can we work together? So I think that's the thing a lot, and that's the energetics, right? Energetics are the
Yeah.
unconscious beliefs that we have. And a lot of that unconscious programming is that we have to be the ones that do it all. So when you have that, it's like, okay, well, that's what you're going to do. But if you change that belief and you go, okay, well, how can I get other people to help me? We still get the same result. Everyone's still looked after, but I don't have to be the one that does it all.
Yep.
Yeah.
Love it.
Um, so yes, red light, that's the fawn response. Then we can also have the freeze response, which is sort of like when you're at the very start of a red light and you sort of zone out and you don't even realize it's turned green and someone toots you from behind. You're like, oh, whoops. So that's sort of like a disassociation. So it can happen when you're sitting in a room and people might be arguing, or someone asks you a question and you sort of just like, I don't, and you just zone out, you just disappear, right? That's a red light response. It can also be when you're mindlessly scrolling on Instagram or watching something. Yeah. So sometimes that can be like, you need to do that. You need to go into that red light because you've been going into those orange lights all the time. It's sort of like you have to actually pull in to a petrol station to refuel and stop. Yeah.
Yeah.
So if you've been going in an orange light, what happens to all of the other things in your fundamentals? Your metabolism speeds up because it's trying to keep going through those orange lights. Then your nutrients morph and change to try and keep up with that. And your blood sugars are also going to alter. They're going to boost up. And it's like, well, no wonder you can't lose weight even though you're starving yourself, because you've got higher sugars in your blood. Your body doesn't want to activate your fat stores to do it. So
Yeah.
this is why everything is related. So that's why I will just like, I can often now look at a patient and go, okay, yep, tell me the patterns, the trends. Yep, okay, I already know what's going on. But to really know what is happening with your fundamentals, it's called Test Your Fundamentals on my website. And I actually use what's called a hair tissue mineral analysis to look at what has been going on in your body. So are you a fast or a slow type? What main light are you in your nervous system? What's happening with your nutrients? Is it an absorption issue? Is it that you're not getting enough in? Is it that you don't have certain other nutrients to help the other ones work? That's why you have iron deficiency, or that's why you have a thyroid issue, or that's why you're experiencing all these functional issues, even though your blood tests are normal. So that's the test that I use to help me assess what's going on with someone's fundamentals. And you get a
That's
really
really nice.
clean cut of like, okay, this is what you need. These are the specific supplements that will help. And these are the different resources you can use to help support each of your fundamentals.
Love
Yeah.
that. And it's very specific. And the more specific you can get, the more you can help people. So I really love that. So very cool, Dr. Anthea. And actually very transformational, because this is actually a topic about women's health that I've not heard before.
Mm,
Okay. I can tell you about how so many people are being put on different types of medications. A lot I see at the moment for usually pregnant and postpartum is antidepressants.
mm-hmm,
To be honest, I see it in more in younger girls now as well.
mm-hmm.
It's coming up on everyone's forms. New patient intake forms. What medications? I'm depressed. I'm taking antidepressants. I'm seeing that a lot more common in women's
And
health.
I think that's the thing is, and medication 1000% has its place. But when we see any symptom, and we can take mental health now, for instance, when we see that as the problem, then we make ourselves the problem. But our body, that symptom is literally telling us something. It's telling us that we're having trouble balancing. So if we're depressed, it can be either there's something in our environment that is making us depressed. Possibly we hate our job, something's going on in our relationship, we're worried about money, whatever it is. It could be something in our external environment, but it also could be something internally in our body. So whenever we have any symptom, it's like, okay, well, is it that I'm lacking the resources internally? Those fundamentals aren't balanced, or
Mm-hmm.
what's happening in my environment? I know personally myself, when I was in my 21st year, I turned 21, I experienced depression for about 6 months, really heavy, out of the blue. And I was like, I don't really understand why this is happening. And when you sort of get in the loop of you don't want to get out of bed in the morning and you're like, well, this is going to be what I feel like the next day and the next day and the next day and the next day. And you just feel like you can't get out of this loop. I remember my mum asking me, what's going on? Like, what's happening? And I literally was like, I don't know. I can't verbalize. I was stuck in that freeze form. I had no idea. And that's how we feel when we're in that red light. You feel depressed, trapped, hopeless, all of those heavy emotions. And what she said to me, she's a very lovely lady. I love her to bits, and she's a chiropractor as well. And she said, you know, let's treat it like it was a broken arm. So if someone had a broken arm and they broke their arm because they fell off a skateboard, it's like, well, it was probably the external environment that caused that broken arm. But if someone broke their arm because they accidentally knocked it slightly and their arm broke, you'd be like, that's an internal thing. Like, as a practitioner, you're thinking, what's going on internally? Like, your bones are really weak. Your arm shouldn't have broken then. So
Yeah.
that's what we looked at there. It's like, okay, well, there was nothing in my life that I was like, there's nothing in my life that's making me, that would make sense to make me depressed. What's going on internally? And what we found was I had really high levels of copper and low levels of zinc, and that actually was affecting my neurotransmitters and helping me, making me feel like that. And that's a very common thing that happens with women, particularly postpartum, because our copper levels go up, and if your gut doesn't work, they don't clear. So you often will get postpartum depression. Same as if you're someone that gets PMDD, or someone that gets very dark moods before their period, like in PMS. Often that's a
Right.
sign that your zinc and copper ratio is off. That will also throw off your iron. So you're probably someone that experiences low iron and heavy periods. So all of these things are linking. It's not the heavy periods. It's not that you have to chase down if it's endometriosis, or obviously we want to stop the heaviness of the bleeding, but we
Mm.
want to go, well, why is your body doing that? It's doing it for a reason. Yes, we hate it, but it's giving you heavy periods for a reason. Let's look at what's underneath. And we always look at those fundamentals to help balance that. Yeah.
That's well. That's well. One, so continuing that, what would be some of the biggest challenges women face today?
Oh my gosh, there's a lot. But
Well, I'll rephrase the question then. Let's say you go back 20 years. You
mhm.
go back 20 years ago and now you come to now. Because in 20 years, we've had the biggest changes in terms of social, in terms of technology, in terms of even like approach to health. What would be the biggest challenges there?
I think one of the biggest things that I see is that your health seems like it's another job. Like it's like another full-time job to look after your body. It's like, what the, it seems so like, oh, okay, I'll listen to this podcast and then that person said this. And it's like, well, there's so much information. And I think that is one of the biggest challenges. Like if I look at the difference between 20 years, although mind you, I was only 10 years old when it was 20 years ago. Um, but I think it's very much a double-edged sword of we've been exposed to a lot more information, which is amazing, but it can become really overwhelming and we can feel like we're doing the wrong thing for our body, or we're scared to be knowing what we should be doing. And it's like, you know what? Looking after your body isn't as hard as people make it out to be, and women's health isn't that scary. It's actually really straightforward. It's actually a lot easier to know what's happening with a woman's hormones than it is with a man's hormones, because a man's hormones can alter every 15 minutes. Did he watch a footy match? Did his team win? Did he get angry? Did he get a promotion? Like those things all change drastically. But if you know where a woman is in her cycle, you can pretty much guess exactly what her hormones are doing. So I think the biggest thing, the biggest challenge is being able to use your body to make decisions and your mind as a resource. That is the ideal. So it's really connecting to your body and trusting what your body is telling you, listening to the symptoms and going, they're not the problem. They're telling me what I need to do. It's amazing. Like, my body is freaking amazing. But what we're doing is we're using our body as a resource and our mind to make decisions. So that's why we feel depleted. That's why we're experiencing all of these different symptoms, because our mind is like, okay, well, I need to do this, I need to do that, I need to that. It's like, yeah, but what is your body telling you it needs to do? Because your body will tell you exactly what you need. Exactly.
And it's that slowing down. It's that slowing down to actually pay attention inside, right?
Yeah.
There's an acronym that we use for pain. I'm not sure if you've heard it before, but it's pain is an acronym for pay attention inside now.
Mm-hmm.
And a lot of the time, people just push themselves. And one of the biggest challenges I've seen in the last 20 years is everyone's always on the go. Males, females, everyone, even younger kids are subjected to so much more um, constant, constant engagement of their mind that they forget to tune in with their own body, listen into their body, right? Take that time for yourself. Just look, listen, ask yourself the questions. What are you trying to tell me?
Mm-hmm.
All right. Why am I like this? It's none of that. It's I'm on the go, 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 go. And you summed it up perfectly. You summed it up perfectly earlier on the episode. So
I think when I talk about the energetics, in my book, it's called What's My Body Telling Me? Um, I talk about the four female fundamentals as the different parts of a car, but your energetics are the GPS. So I think it's really important to know, where do I actually want to go? And I think when we're so busy running around going go, 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 it's like, are you actually focusing on where you want to go? Like, what do you actually want? And often when I ask patients, like, what's your ideal? What do you want? They're like, oh, I just don't want to feel tired. I'm like, I didn't ask you what you didn't want. I asked you what you do want. And it's like, wait, what? And then knowing why you want it. Because we can be looking on Instagram and going like, oh my gosh, I would love to have a six pack. It's like, would you really? Like, why do you want that? What do you think that's going to give you? Or I would love to feel energized. It's like, why do you want that? Like, because then I can have time to spend with my kids and I feel like I want to, and I can actually live my life and feel alive. It's like, amazing. All right, let's connect to that. Instead of going, I just don't want to feel tired. It's like, it's very different. So if we can really tune into, what do I want? What do I want? Not
yeah,
what my Instagram or all of the information that's coming in being like, well, you should want a Lamborghini and a six pack and millions of dollars and all this stuff. It's like, do you really want that? Is it actually going to bring you what you want? So I think that's really tuning into, okay, what do I want? Let's program my GPS for that, and then support my fundamentals, support the functional health, and then away you go. You're giving your body exactly what it needs, and tune into your body and it'll tell you whether you're going off course or not.
and touching on that, how you said you need to know what you want. Sometimes, yeah, in life there's mentors. We all have our mentors. We all have our people that we look up to and people that we don't look up to. If I said to you, Anthea, I want you to think of one person in your life that you don't want to be like. Can you picture that person?
Mm-hmm.
You don't have to tell who they are.
I'm
Can
not
you
going to
picture it?
tell you, but I can.
Yeah,
Yeah.
right. I can do the same. But then I can also say to you, can you think of that one person in your life who you'd love to be like?
Mm, yeah.
Okay, everyone has a mentor, an ideal, like someone they look up to. But there's also people that people don't want to look up to.
Mm,
Okay, and I can tell you, majority of the time is usually it's someone in their own family. Could be their mum and dad. They could be like, man, my mum's a rock star. I want to be like my mum. But then sometimes it's like, my dad is just like this, and I do not want to end up like him.
mm.
Right? It could be an uncle, could be a really good friend, or it could be a teacher, could be whoever. It could be even like on socials, right? People that people look up to. The most important thing is who you surround yourself with really dictates in your environment how healthy you're going to end up as well.
Mm.
And talking about just women's health, it's such a big, broad area, and you are summarizing so well, saying, look, you got to start to pay attention to yourself. But sometimes people need that extra support. People need that mentor or that coach to be able to support them and guide them,
Mm.
right? The right doctor to help support them.
Oh, a million percent. I'm not expecting anyone to know the amount of information that I know or be able to tune into that. I can tell you the questions that I get on my Instagram is like, what's my body telling me if I have all these random things? I'm like, oh my gosh, like there's a lot of unanswered questions that we have. But yes, I think it is extremely important to have people around you to support you in either you look up to them and go, oh, there's that part of their life I really love. I would love if that part of their life was my part of my life, or all of their life was my part of my life. But it's really important to be able to find a practitioner or someone that can help support you and really connect you back into your body and connect you into what you want. And that's actually why I'm just about to launch. It's called Female Fundamentals Membership, and it's giving women what they need when they're lost in the space between. So that energetic help and the functional help, and it's got the community of people that are literally supporting you and going, okay, what do you want? And let's gear toward that. And remember, your body is on your side. Like, what is that symptom telling you? So it's really helping program your mind to think differently about your body and connect you to your body in a completely different way. Like, this is not what we talk about in healthcare. It's not what we talk about in society. It's not
Yeah.
how we think, but it should be how we think. And that's
Yes.
my mission, is to change how people think about their body.
I love that. So for the women listening on this episode today, how can they connect with you better?
So I'm on Instagram at Dr. as in Dr. Anthea Todd. So you can find me on there, or my website is called femalefundamentals.com.au, and you can find links to the membership, my book, and also to that Test Your Fundamentals test that I was talking about as well on there. I do also work one-on-one with women. There's a wait list already. I'm starting back in July. But yeah, so you can fill out a form and join the wait list for that too. So yeah, that's how you can work with me.
Love it. Love it so
Yeah,
much. And thank you so much for your time, Anthea. I really appreciate it.
no
Is
problems
there,
at all. Thanks so much
is
for
there,
having me.
oh, always. Is there any last comments that you'd like to leave with? Anything else that you'd like to say?
I guess the one thing that I would love to say is just remember, your body is always on your side. Always.
Your body is smart, it's intelligent, it knows what it's doing, so please listen to it. Don't just ignore it. Don't ignore it, because if you ignore things, the problems will build up. It's like forgive me for this, but it's like, I don't do this. I don't do this. But it's like getting a laundry and just leaving it and leaving it and then be
Yeah,
like, yeah, where's my fresh clothes at? You got to
yeah,
clean that.
yeah.
I don't do that. No. All right. I'll
Very
see you
good.
later, bud.
Thank you. Bye.